Thank you for being here this afternoon with us for the governor's announcement. I am Jay Ellington. I'm the city manager for the Texarkana, Arkansas side. I'm glad to be here. I am a substitute this afternoon for Mayor Brown, who is off on vacation, and it's nice to get some of those times out, but you know, we need them around every once in a while too, you know, but I was glad to step in and take care of this for him today. I know I have Judge Harrison here and Mayor Bergman from the Texas side as well, and I'm sure there are a host of other people who I don't know yet, but thank you all for your public service if you're serving in one of those capacities for us. You know, it's an honor always to introduce somebody at the level of a governor. It makes no difference what level I'm at or what level you're at. It's always an honor to do something like this. Well, this gentleman doesn't need a whole lot of introduction, not to us on the Arkansas side anyway, but he's always been in the forefront of things in relationship to health of the state of Arkansas. And he's had several things during his first term and is continuing to stay on top of those for all of those of us who live here. And this is one of those times that he wants to talk to us about health and health-related issues. And without further ado, I'll introduce Asa Hutchinson, Governor of Arkansas.
Thank you, and I want to thank everyone for coming out tonight. It's Thursday night, there's a lot going on, but this is an important topic for us. And I look at the path of the pandemic that we've gone through, and we've gone through a lot of different stages. But we've come to the point that it's really about what each individual does and what each community does in terms of getting prepared, getting vaccinations out, having discussions. And so that's why I started the community COVID conversations. And so I've been to Batesville, I've been to Jonesboro, Blytheville, Forest City, Cabot. I was in Fayetteville today, at lunch today, and down here tonight. And so we're maximizing the time, but it was very, very important for me to get here this week. And I wanted to be here in Texarkana, and I'm always love being here. I'm delighted we have Texas side here, some of the officials from the hospital, St. Michael's, as well as public officials. Delighted to have our Arkansas representatives here, Representative Carol Dalby, Representative Lane Jean, and then Representative Danny Watson. Where's Danny? Thank you, Danny. And Mayor Brown has always been helpful here as well. We've got Judge Kathy Hardison Harrison. Where's Judge? Back here. Judge, you got to come up here. Come on, get up here. But let me set the stage for this, first of all. And a month ago, just a short month ago, we were in pretty good shape in Arkansas. And if you look at it statistically, a month ago, which was June 7th, so just a little bit over a month ago, we had 1,594 cases, active cases. So round that up to 1,600. A month ago, 1,600 active cases. Now we have 9,000 active cases. If you look at the daily new cases that we had, a month ago, June 7th, we had 62 new cases on that particular day statewide. Now, today, we had 980 new cases. And yesterday, I believe it was 1,200. The day before, it was over 1,000 as well. If you look at our hospitalizations, which is what we have to look at most closely, on June 7th, we had 175 hospitalizations because of COVID. Today, we have 669. Now, what has happened? What has happened? And there's really two reasons for this total different change in climate, and it's not just Arkansas, it's across the nation. Because as I meet with the White House, as I talk to our COVID task force in Washington and the CDC, they say over 50% of the new cases across the country are because of the Delta variant. The Delta variant started in India. It came here. They renamed it the Delta variant. It really hit us in southern Missouri. It leaked over into Arkansas, and it is spread. And of course, it's spread from different directions because it's in Texas as well. But it's really across the nation, the Delta variant. And what's unique about the Delta variant is that it is more transmissible. That means it's easier to spread. And then secondly, and this is something that's significant, is that you're twice as likely with the Delta variant to go to the hospital. And so the hospitalization rate is higher. And that's one of the reasons such a quick increase in our hospitalizations is because of that Delta variant. We also have a second ingredient that hits us in Arkansas a little bit harder, and that is we have low vaccination rates. And in Arkansas, we have a low vaccination rate. And that's not something I'm happy about. That's one of the things we're trying to address. And early on, whenever it was hard to get the vaccination, remember that? We didn't have enough of the doses, and we were waiting on that, and we were having people wait in line, and the demand was great, and we had to prioritize it. And we said, we're going to get the 65 plus vaccinated. Well, they responded very well because they had a high vulnerability. And the result was that they got vaccinated, and you see their hospitalization rate go down. But what we're seeing in our hospitals is that the average age of our hospitalized COVID patients has gone from over 65 down to the age 54. And why is that? Because the Delta variant hits you hard, but also because that's the age group we're not getting vaccinated at the rate we want, and that's between 20 and 50. And that age group, we've got to get those vaccinated. Now, if a couple of interesting points on the vaccinations. Let's look at Texarkana and Miller County. And first of all, let me concede the point that we don't have as good a data as we want to. And so you see these very low numbers here in Miller County and Texarkana, and we know that we're not getting all the Texas data. Sometimes you'll go to St. Michael's, you'll go to a physician in Texas, you'll get vaccinated. And so I know you're doing better than what the statistics show. But so understand that, but at the same time, you look at our surrounding counties in Little River County, you look at Lafayette County. In each of those counties, they are lower than even our state average of vaccination. And our state vaccination rate is about 15 points lower than the national vaccination rate. So you can see the challenge that we face. And so I do want to show you, the Miller County, we've got 9.5% of Miller County is fully vaccinated, but Texarkana itself is 17% of the population is fully vaccinated. Well, we got it up here, don't we? Let me move over a little bit. And so let's pull up another county, though. What do you have? Batesville and Independence County. And this is a point that I want to make, though, because you see on the left, those are the ones that are fully immunized. And then where it says 13.9%, that's partially immunized. So the left side is Batesville, and these two on the right side is Independence County. Now, look at Batesville. 69% of the people in Batesville are fully vaccinated. That's incredible. But then Independence County is 29%. Just think if you didn't have Batesville at 69%, how low the whole county would be. And so, and do you have another one there, or is that it there? Searcy and White County, the same thing. In Searcy, 62%, but the whole county's 34%. And so if we had true data, and you can see it just in comparison, that the cities are getting vaccinated at a higher rate than our rural areas. And that is a challenge for us. And so those are parts of the reason we have a low vaccination rate. We also have some resistance out there. There's a little bit of myth going on in our society. There was an email went out before my first COVID conversation. It was actually sent out by Secure Arkansas. Some of our legislators might have heard of them. But they said, watch out for the governor's town hall meetings. He's trying to do mass vaccination. And he said, and they went on to say that it's going to result in mind control if you get vaccinated. And they went ahead and tried to explain all of that, and magnetic connections and 5G. And then it said, when you talk about vaccination, don't use the word vaccination. Use the term bioweapon. That it's not a vaccination, it's a bioweapon. So they're trying to scare people away from getting vaccinated. And the only answer to that is truth. And so tonight, as we have a conversation, some of you have you might have good reasons that you're not getting vaccinated, or you just might have questions about, whether it's healthy or not. I've got some medical professionals, we've got some trusted, so we're going to have a community conversation, respectfully listen to each other and respectfully making comments, and we'd like to get around and hear from everybody. And by the way, we have, as you saw as you came in, St. Michael's, that is good enough to have a clinic out there. If you want to get vaccinated, there's an opportunity there for you. We have no mandates in Arkansas. Nobody is knocking on your door and making you do this. It is all about your decisions and trying to make the right decision for your family and for your community. I have Dr. Jose Romero here, who's our Secretary of Education. Many of you have seen him with me on some of our news conferences. Thank you, Jose, for being here, and he's a great help as we try to work our way through this. All right, so I've talked enough. I came here to listen, and so the floor is open for questions, and it can be a comment, again, if you're respectful and you just have, some points that you want to make. Yes, sir. And we got a microphone here.
Governor, my name's Harvey Woods. I'm an Arkansan by birth, University of Arkansas graduate. I've even been to one of I believe it was your last governor's breakfast in Little Rock.
Thank you.
So I'm a conservative and a supporter. But I'm actually here to make an appeal. I am anti-vax. I see that there's some inherent problems with the whole system that really trouble me. The lack of scientific openness, the way it's set up, where there's a the government of the United States is pushing this to get everyone vaccinated, but they're not allowing for data to be collected as to the effectiveness. There's a lot of questions about whether it's going to cause harm. The governor of Ohio today issued a stop on any kind of mandated vaccination for school children in his state. The FDA has issued a heightened warning on the Pfizer vaccine because it increases the risk of Guillain-Barré in young adults, several points. And I could go on, but I think my point is made. There's a lot that's not known. We don't have a free society that can have a conversation about it because of censorship, and I just don't trust it.
Okay.
So,
terrific.
My appeal is that as the chair of the National Governors Association, you're in a great position, and I just would pray and hope that you would issue a call for people to wake up.
Good. Thank you for sharing that. Again, a very respectful tone. You express yourself, and that's what this is all about. So there's no problem in you articulating that as well as you did. Now, let me just address a couple things that you mentioned. The Ohio governor that issued saying that we're not going to have any mandates to vaccinate school children. Well, that is absolutely the same case in Arkansas. We do not have any mandate that the COVID vaccine is going to be mandated in the schools. It's not going to be. There's a law against that. Now, we've always had vaccinations. When I went to school, probably when you went to school, we got smallpox vaccination, we got other vaccinations. Many of those are mandatory. But in this instance, we do not have that as a mandatory action for our schools. In fact, it's prohibited. Now, in reference to the Pfizer, in the data that you mentioned, Dr. Romero, I'm going to let him comment on it because he studies that data all the time. And the data is all available on the CDC website. It's very public. And the FDA is actually going through a very methodical process to review the vaccines and the data for it. But remember whenever there was a pause on the Pfizer? Remember that? It was a pause on the Pfizer, and it was very transparent. I actually criticized it because I thought that pause was unnecessary, but they saw some small level of data, and so they paused the Pfizer, and it was very, very transparent. But let me ask, though, how would you suggest that I, as governor, you think it's okay if people decide on their own to get vaccines? And do you believe that COVID is real? Yeah. Okay. Dr. Romero, did you want to comment any on the data side?
Sure, if you'd allow me to. It's actually the Johnson & Johnson vaccine that has the GBS issue. And it's very easy to confuse them. There's so many vaccines, I have a hard time remembering all of them. But that data, it's a signal. As a matter of fact, literally before I got on the plane with the governor, I was on a 2-hour call with the CDC reviewing that data. It'll be reviewed publicly. All of the data on safety is publicly reviewed on a monthly basis since we started this pandemic. It is available on the web. You can dial in and watch the discussions, watch the debates about this, and see the data itself. I can guarantee you that we have the safest vaccine system in the world. Safety has been paramount throughout the development of these vaccines, throughout the testing of these vaccines, and even after the vaccines have been put into circulation. There are 5 systems available in the United States to track these very rare occurrences, and that's why we're finding them. Because as the governor said, there was a pause placed on the vaccine because of a signal, okay, a possibility of clots forming. There was another signal for allergy, okay, and this is the third signal. These are extremely rare events, and the CDC, the ACIP, FDA measures these in a risk or benefit analysis and makes that recommendation to the public.
Thank you. Next. Yes, ma'am.
My name is Teresa Cox, and I live here in Texarkana by way of Mississippi. If we're going back into a COVID situation, what are we going to do about food insecurity for senior citizens? I do get SNAP benefits, $19 a month. I want to meet the person who can eat for a month for $19. I buy bread and peanut butter. That's all I can afford. So the middle of the month, I go to Genoa to my son's and raid his kitchen. I break into his house and steal food. What are we going to do? Why can't we get the benefits we were getting to take care of it? Okay. There's a program from the USDA, Seniors Farmers Market Nutritional Program. No one in Miller County knows anything about it. What are we going to do to get food for senior citizens?
Thank you. I appreciate you sharing that. Obviously, everybody ought to have the opportunity to provide for themselves and others. In terms of the SNAP benefits, we continue to provide the SNAP benefits in Arkansas, and so the SNAP benefits are available. That sounds very meager, what you recited, so we might look into that a little bit. And we also have, and I've been here to the food bank that does an incredible job here, and we support that, and we have actually a significant amount of state money that flowed to us from the federal government that can be used for food assistance. So we have plenty of money. Jordan Burgess is right here, and she can follow up specifically because there's a gap there. There's plenty of assistance that's available, and we want to make sure you have access to that. All right, back in the back, I'm a Baptist, so I understand what y'all are doing back there. And so, this is an environment I can call on people here. But any other, more comments? Yes, ma'am.
Edward Jenner observed that cowmaids did not contract smallpox because they had cowpox. Now the smallpox vaccine is not even administered. It's considered eradicated. That's progress.
Yes. Yeah. Well stated. You're young enough to remember. Well, thank you for that comment. And vaccines is not something that's unusual in our society. Growing up, we all remember that experience, but we also, there's the flu vaccine, and we have a percent of the Arkansas population that doesn't get the flu vaccine, so you always have that. But we've never had, in my lifetime, and in yours, ma'am, we've never had a virus that is as dangerous and as contagious and as deadly as what we have with COVID. And so that's why it's not just like we need to get the flu shot, which I promote that once a year because I get the flu shot. This is just more serious. I'm spending a lot more time on it. So thank you, ma'am, for sharing that. Yes. Where?
Yes, Laney Harris. I'm a Hero City Councilor on
Yes.
Arkansas side, and thank you for coming here, Governor. My question is that, well, maybe a comment. I know some states giving away $100,000 for a lottery if you put your name in the hat if you take the vaccination, up the chance for $1 million. And I don't think you have done nothing like that. And in my opinion, I kind of hope that you don't do nothing like that. But the other thing is, I have been asked about this, and I guess the reason why I'm from other minorities, and they have a fear that it's been a history that in some cases, like the Tuskegee, what was it called, Tuskegee institution, when they back then when they was experimenting with
African Americans.
African American.
Yeah.
So how is you gonna go about? How is this state gonna go out to outreach African American and tell them that it's okay for this because of past history how African Americans have been being treated by the government when some experiment?
And that's such a terrible, tragic history in our country. And that's where a reluctance of many African Americans come from. And I've been grateful that we have worked with a number of African American church leaders, sports figures, community leaders, and we don't expect everybody to trust what I say or necessarily others say, but the leaders in the African American community, we're trying to get their voice out there. Because they're trusted and to hear what they have to say. But Dr. Romero makes the point that as they tested these vaccines, they tested it on every minority type population, every age group, every minority, and they studied it and the impact on it. So that was a part of the original studies that were approved by the FDA. Now, on a little bit of a lighthearted note, I had in Forest City, I believe it was, a African-American minister stood up and said he was hesitant about getting the vaccine, so he went there to get the vaccine, though, and he made sure that he was getting the same vaccine that his neighbors were getting. And so he was checking it out there, but that was his comical way of trying to encourage others that It worked well for him. It was beneficial. It allowed him to get back to a normal life. So let me ask you, Councilman, that what do you think we can do more to get the word out? And I agree with your point. Incentives, I'm open to incentives that we can show they work, but we haven't seen a whole lot yet that's been effective in that way. A lot of the private businesses are offering some incentives in their workplace. But what can we do, not just in your community, but across the Texarkana and Miller County area to encourage people more or to build confidence?
I don't think I can probably say time, but I don't know. That's a hard question for me to answer right now because I've looked at the information and I know I'm not a doctor, but I'm still skeptical in a way. So it's hard for me to come out and say something, tell somebody else to do something when I'm skeptical of my own self. So I can't sit up here and tell you, answer that question.
And the skepticism is based upon health concerns.
Right,
All right. So let me turn to, we've got a doctor, who wants to respond to that from a medical standpoint? Can I get some help here? Yes, sir. Introduce yourself.
Thank you for coming, Governor. I'm Dr. Young, the Bowie County Health Authority, which is on the Texas side of Texarkana, USA. But Dr. Stringfellow's here with the Miller County Health Authority. Dr. Robinson's here with St. Michael's, and Joe Bennett is the Miller County Office of Emergency Manager. We've all worked extremely hard together, try to get the word out. And we do have to remember, I think the young lady mentioned smallpox, you know. And what I always want to tell people, if this was smallpox or polio, we would never have beaten this. So what we have to realize that vaccination is about the only way we know that we can actually overcome this. And I agree, there needs to be more information on the vaccinations. We need to take social media out of it, get the facts, the true facts, and know exactly what you want to know. And then you need to be able to do your own research. And again, mentioning the flu vaccine's only about 60 to 70% effective. You can still get the flu if you get the vaccine. However, it's going to potentially save your life instead of you dying. And the same thing goes for the COVID vaccination. The COVID vaccination is more than likely going to prevent you from getting hospitalized or putting on the vent. And for all of us, I'm an emergency medicine physician by trade. I'm the EMS medical director. I have had colleagues that I've worked with side by side die from this. And I'm not talking about somebody old, a 48-year-old healthy individual die from this. So, you know, for us, we see it daily, and it is something that we need to get the word out. There's not been enough data because it is so quick and we've moved so quick. So it does take a longer time to get the data, but we know it's the only thing that we can truly do other than good strict hand washing, social distancing, and then the vaccination. So again, we've seen so few flu cases because of those two things, the strict hand washing and the masking. We've seen very few RSV, respiratory syncytial virus, on the pediatric patients until now, but that's because, you know, we're getting around more, we're communicating. Many people have taken off their mask. So we just want to get the word out that vaccination is the key, and we sure do not want it to affect the pediatric population, because if this COVID hit that took the adult population out, there are not enough pediatric ICU beds in this country to take care of that kind of disease process in children. So that's another reason to get it, is to prevent family members from getting it, even if you're a asymptomatic carrier. Thank you.
No, it's great. It was great. Yes, please, right here. Introduce yourself again.
Sure. Good evening, everyone. My name is Dr. Lauren Robinson. I am the Chief Medical Officer at Christus St. Michael Hospital. I am trained as an internal medicine doctor and a pediatrician. So I take care of folks across the lifespan, and I'd like to respond to a couple comments if you all give me a second. So I'm not anti-vax, I'm in general pro-vax, but I like to understand where people are coming from. And so I watched the movie Vax so I could get a better idea of what kind of folks who are anti-vax are talking about. And for me, one of the things that I was very concerned about at the beginning is that this happened so quickly. COVID got here and we got a vaccine faster than you get a tax refund. And so I was like, wow, government really can work really fast, but is this really a good reason for me to take the vaccine? The other thing for me was that I was pregnant. So when the vaccine first came to Texarkana, I was pregnant. I was too early to tell anybody, and I was really scared because I was like, early in your pregnancy is when you're most vulnerable. And so I knew for me, I was like, I don't know that I can get out here and say, yes, I'm taking the vaccine. Is this putting me at risk? And there was no data on pregnant women. And so when I talked to my OBGYN provider, she said, I don't really know what to tell you because we don't have this data. And when you look at the data that we have, it comes from the people making the vaccines. And so it's like, well, if I was making something that I wanted you all to buy, of course I would say, this is safe, you should take it. And so at the time, I was just like, I just really don't know. And so I think what it came down to was hearing from my colleagues who took it either in the study or got it earlier on. And just seeing kind of, one of the things that we have here is this natural experiment that all of America and the whole world has seen over a year. So you've got people who signed up to be first in line. That's not my ministry. I'm not going to jump to be first. But I got to see doctors, moms, husbands, sons, aunts, uncles, all these people all across the country sign up to be first and watch to see how they did. And most people did completely fine. And so I was like, okay, I can say most folks are doing completely fine. If that's the decision you make for you, please do this to protect your families. And then the more data that came out and the more data that came out, and then I had friends who had been pregnant who also, like me, hadn't told anybody, but they took that leap of faith and they got vaccinated. And so I have these women who starting in like March, April, May started to give birth and say, I'm healthy, I made it through my pregnancy, my baby is healthy. And when they tested for these babies to see if they had antibodies, they did, meaning if somebody wasn't vaccinated or had COVID around them, these babies were going to have a better chance of making it than someone who wasn't vaccinated or the child of a mom who wasn't vaccinated. And that's what flipped it for me. And so when I was later in my pregnancy in April, which is in my third trimester, when you're again vulnerable and you could deliver your baby too early and there was a risk, like if you get this vaccine, you could have gone into labor. I made that decision for me and for my baby. And I was nervous, and my husband was more nervous than me. And so we decided the one thing that we did do is we spaced our vaccines a week apart because we knew that we may have a reaction to it. Women are very strong, and so I got my vaccine and I was fine. My husband had a little bit of chills, but we did okay. And my mom, who was like, I'm not getting that vaccine, was like, I want to see my grandbaby. And so she decided to get the vaccine. And that was another thing that, for me, I had not expected. I expected her to wear her mask, which she would have done to protect her grandson, but she had said she wasn't going to get the vaccine. And when she made that decision, she decided that for her, it was worth it to start talking to seniors in her community about if we want to protect our grandbabies, if we want to see our grandbabies and love on our grandbabies, because they're very cute, it's important for us to get vaccinated because, yeah, someone may end up getting COVID if they get the vaccine, but they're going to be around to tell the story. They may not be admitted to the ICU. They're not going to pass away. And that's the thing to me that was so important to me, to my family. And then to the gentleman's point about the black community, the African-American community, I think it takes people taking that leap of faith and getting vaccinated. It takes people who are going to say, okay, I'm going to put myself out there, and then I'm also going to tell my story. I think for so long, we assume that people who don't look like us or don't worship where we do or don't go to the mall with us or who are masked or not wearing a mask, we make assumptions. So you might see someone in a mask and be like, well, they probably didn't get it. Or you'll see someone without a mask and be like, well, they probably didn't get it. But the thing is, just talk to people. Tell them your story. Because at the end of the day, we're all human. And everybody is experiencing this in real time and has their own story to tell. And you don't know why somebody did or didn't get vaccinated. And that might be the story that changes your mind or changes your heart. So I would say to keep an open mind and keep an open heart. We'll try to give you the data as it comes along, knowing that it seems like the data doesn't make sense because one day someone's saying 85%, 75%, and you can't remember if that's the number of people vaccinated or how effective it is, and it all comes together. I'm not a numbers person. So I'm just saying, think about it, pray about it, talk to the leaders in your community, and make the decision that's right for you and your family.
Hear, hear. Thank you. That's what you call a trusted voice. And that's what you know, everybody, when they think through, is this right for me? Is this what I need to do? You got to think through, who do I trust? And go talk to that. Whether it's your physician, which it should be someone in that category. Sometimes it's a pastor. Yes? Why don't you go ahead and get a microphone here? We have them back here? Okay.
You just hit on something I think that causes a lot of people to have reservations, and that's trust. You know, when this first got publicized, Fauci said, oh, you don't have to wear masks. Then it was, you have to wear masks. And from what reports I've been seeing in the past few months, Fauci actually used our tax dollars to help fund that Wuhan lab, which chances are that's who developed this disease. And I think, I wonder, why is he still the most paid bureaucrat in our federal government?
Yeah. Well,
That doesn't make sense. The trust from the very beginning has been broken.
let me make sure it's clear. I'm not asking you to trust government. I'm not asking you to trust government. I'm asking you to do your own research, talk to people that you trust, and that, to me, is the right approach. And Dr. Fauci, I can assure you, I've made mistakes through this pandemic. We do particularly when it was early on, you make the best judgments you can, but don't trust the government. You know, I'm not asking you to. Let's do our own thinking here. Right back here, ma'am.
Good evening. I'm Lakia Jones, and I'm with the Church of the Living God here in
Yes.
Texarkana. And I just wanted to personally say thank you, Governor Hutchinson, for all that you're doing for Arkansans. And I want to personally thank our friend, Carol Dobby. She's doing a lot for Texarkana and Miller County, and we appreciate her. And we thank you, sir. Thank you so much.
Well, and to tell me how your church is doing and what you're telling them.
Well, we're doing great. We did partner with College Hill Medical, and we actually sponsored, we hosted several clinics here. Of course, I think it was like four consecutive weeks in a row. And we also partnered with St. Michael's and Dr. Robinson. We hosted clinics here as well. So we just thank you for the opportunity. Thank you for looking out for us. We had at least one of those clinics, there was at least 300 folks that showed up to be
Fantastic.
vaccinated. So keep us safe, and we appreciate you very much.
Thank you. Thank you. Great comment. All right, so we'll go to this lady, and you've got a question, and then we've got a question too, or a comment. So let's go ahead to these, yeah, there.
I'd like to ask a lot of these doctors, I'm allergic to a lot of medications and a lot of foods, and it scares the out of me to take this vaccine.
All right, Dr. Romero, or what? Let's talk with a local doctor here.
No, we've had that question before, and that's a great question. And that's why after you get the vaccination, first of all the vaccinations have the ingredients that are listed, and you can actually go online and find those ingredients. And then the second thing is at all the vaccination clinics that we provide, that's the majority of the time when you have to wait afterwards, we're making you wait to make sure you don't have an acute emergent allergic reaction that we have to treat. So that's the whole point of that wait time. And then also there's a particular system that will call you or text you to make sure how you're doing every 24 hours at first, and then it goes to every 2 days, every week or so. So that's a great question. And that is probably the only reason for somebody to not get vaccinated, but the only way to figure out if you're allergic to the vaccine is get vaccinated. And that's why we have the emergency personnel on site with the emergency drugs to be able to resuscitate you. And I can say from being at the vaccination clinics, we have had very few acute allergic reactions to the vaccines.
Thank you, Dr. Romero. Do you have anything else to add on that? Good.
Quickly, that really there is no contraindication unless you've had an allergic reaction to something that's been given to you that's in the vaccine. So by discussing it with your provider, whoever's giving you that vaccine, they can tell you whether you can take it. And by and large, almost everybody can do it. And all of us are prepared to perform anything that's necessary to help you if you have an allergic reaction.
I was going to follow up. I think that's the thing. Before you get vaccinated, I think it definitely is scary to think, oh, if something happens, they would save me. But definitely sit down with your doctor and look through what the ingredients of the vaccine are, just so you can say, look, these are my allergies. And even if you have pages and pages of allergies, that's why we go to med school, to sit down with you and go through all of those food allergies or medicine allergies, just to see if there's anything there. And the vaccines are different, and so we can look through the ingredients, review that with you, and decide if that vaccine is going to be safe for you. And I can say we at Christus St. Michael administered over 25,000 vaccines. We had people come from other countries, as far away as Spain, who came, and they were here, and they came and got vaccinated, and we didn't have one allergic reaction, despite someone telling me, I take this medication I was allergic to it in the past. This ingredient is in it, and I sat there with her, and she got it, and she didn't have any vaccine allergy at all. And so it's worth talking with your doctor. Okay. Oh, good. Well, I hope that our doctors, we can touch base with them to make sure that they review that with you. Oh, good. Well, we have the vaccine available at the clinic still, so we'll make sure that they review that with you.
All right, so we have right here, sir, and then we'll come back there.
I really didn't come here to be the devil's advocate, but there are just some things about this situation that truly bother me, and my concern is real. I'm not trying to wreck your party or convince people otherwise, but I've got real concerns for the people long term, what the repercussions could be, which we don't know. But in the beginning, and the gentleman here touched on the trust issue, the fact that this is issued under an emergency use authorization is phony, because emergency use authorizations only are allowed if there's not some other drug on the market that is effective. And it's clear that ivermectin is effective, but even that information is being squashed. President Trump tried to make hydroxychloroquine available, and it was like, because he said it, it was unacceptable, when everywhere else it's been effective. Zinc, other things. Anyway, my whole point is, and I'll leave it at this, there's so many things that have affected our trust, and we don't know. We're rushing headlong into a technology we have no way of knowing long-term effects. That's my concern.
Sure. Thank you. And listen, you're not spoiling our party, you're making it a party. You know, it's hard to have a conversation if it's not two ways. So again, no, well, we're not. You know, and so, but there is a counterpoint. First of all, you mentioned President Trump. I wake up about 2 mornings a week and turn on the radio, and there's President Trump's voice encouraging everybody to get the vaccination. And he got the vaccine, and he believes in it, and so, you know, a lot of, you know, yeah, okay. Well, all right, now we got 2. He and Dr. Fauci and me, we're not perfect. All right, but anyway, I'd make that point. But I think I'd like to have probably Dr. Romero. How about what we don't know about long-term side of this, Dr. Romero?
Right. So, you know, to talk about some of these misconceptions and false rumors about the vaccine does not affect fertility. We know that. We understand that, because there's no correlate in the human body that reacts with the vaccine. Second of all, this misconception that in some way the virus alters your DNA, that is not true. It has no effect whatsoever on your DNA. So there is, as we can see right now, no long-term effect other than protecting you from the virus, and we continue to watch that. Again, the 5 safety systems that are in existence in this country are designed to look for these problems, and we see no safety signals at this time.
Okay, but would you concede that, I mean, the future is unknown. We don't know. I'm just saying that's a fair observation.
I think that you can't argue with that. That the future is unknown, but we are watching for it, right? I mean, that's what I meant by our safety systems. We continue to watch into the future.
Yes, ma'am.
Good.
All right. Then we're going to come here. Okay.
I'm Donna Fulton. I'm a retired state employee, Arkansas, by the way. Both of my daughters work in healthcare, and one's a nurse and the other's a respiratory therapist. And my daughter, who's a respiratory therapist, started telling us when the pandemic began, and even before it hit the state, she'd say, "It's coming, Mom, it's coming, it's going to be here." She was watching the worldwide stats. And then as it began in New York and began to spread, and we saw what other states and what the nation was going through trying to battle this pandemic, you know, it was extremely difficult. We didn't have a vaccine. We didn't have anything there. We saw those trucks that were portable morgues, and you saw people dying. And from my girls who have worked in healthcare, they saw healthcare workers getting sick. They lost co-workers. My daughter will tell you what it's like to put a patient on the vent, and some come off of it, but many don't. And then there's the secondary effects of COVID that I haven't heard anyone address here today. But you know, sometimes there's other things. We lost a grandson-in-law because he got COVID, and he was a paramedic. And then he went home, still positive for COVID, decided to take a motorcycle ride, had a stroke secondary to COVID. And we ended up losing him. But I've known a number of people personally that have had COVID. What they've been through is so much greater than what anyone I've heard of has went through as a result of taking the vaccine. The vaccine may have some minor side effects, but we don't hear much about people dying from it. You know, we don't hear people having strokes from it. And the thing of it is that when you're vaccinated, not only do you protect yourself, but you protect those around you. And a lot of people with health issues need that additional protection. Thank you.
Ma'am, your answer was a lot better than mine. Well said. Thank you for sharing that. And then right here.
Good afternoon. My name is Sylvia from a neighboring county in Hempstead. So good afternoon to my neighbors here. I'd see that, or listening, that a through line through tonight's conversation and perhaps in the other conversations has been education and engagement. And my challenge is understanding why the state has not initiated a more robust public health engagement strategy and tactics. Speaking of the neighbor behind me from the Church of God, I'm sorry if I got the name wrong, but identifying those places of worship in targeted zip codes, helping them to put on the door-to-door canvassing, the COVID clinics, the vaccine clinics, which leads to the question of, we obviously have a significant infusion of resources from the American Rescue Plan. Where are the dollars being implemented here in the state? Again, to match the data of what we're seeing from neighbors raising concerns about various hesitancy reasons, so that we know how to counter that, what method they're getting that information, so that you can counter that, whether that's through social media, television, radio, what have you. So the overall question is, where are the resources to initiate that more detailed public engagement? And certainly with your role at NGA, you have a broad landscape to look at those options and best practices.
Outstanding. Thank you for the comment, and thank you for coming from Hempstead County. I guess it's Hope or Fulton. Thank you for being here. And the answer is, we do have resources to utilize to get the word out on vaccination, to handle our COVID response. And we've used those resources that we have early on for our hospitals that handle COVID patients. We utilized it to expand testing capacity. We utilized it for making sure that we had the vaccines. Of course, the vaccines came from federally, but we had a distribution process. So we've utilized those resources. We've also used it for, of course, the contact tracing, but now it is about the marketing. So we do have a marketing campaign that we're putting millions of dollars into. In fact, before we leave tonight, I'll show one of the ads. But I've made the case that I'm not sure we've put enough dollars in the TV that impacts Southwest Arkansas, which is, of course, some Louisiana TV. How many of y'all have seen advertising on television asking you to get vaccinations? All right, so most of you have, but hopefully we'll be putting more dollars into the Louisiana station so we can tailor make it. And I think that's to your point too, that we can have a generic ad campaign, or we can have specific for specific groups and messages, and we're going to continue to work on that. In terms of the outreach, we do have some contracts with some community organizations for outreach on vaccine, and we have more resources available. So that's one of the reasons we're here, is what can we do better? Because we've implemented a lot of strategies to get the vaccines out and to get the word out, but we're open to better ideas. And if there's community organizations that can offer us, we're willing to put some dollars behind it. Yes, sir.
Thank you, Governor, for visiting with us tonight. My name is Joe Bennett. I'm the Miller County Emergency Management Director. And to preface this comment or suggestion, I'll go back to making sure that you understand our office in Miller County is intricately involved in the COVID pandemic from day one. Early on, we worked with Dr. Young, several doctors. Our neighboring counties established a joint emergency operations center. From there, we went on. One of the things I would suggest is that, you know, in every county in Arkansas, we have an emergency management coordinator, and these coordinators know the demographics of their county. They are boots on the ground. Rarely are we asked for any information based on what suggestions we would provide. I would suggest that looking at the demographics of our county, we obviously know that the rural areas are the ones that need to be targeted. A lot of times we have smaller groups, whether they're civic groups or faith-based organizations in these smaller areas of the county, that may not pay attention to city or county government or state government, even federal government, but they do pay attention to their civic leaders or their church congregations or their pastors. And a case in point is recently within Southwest Arkansas, within the last 2 weeks, we had around 20 people from one congregation develop COVID, none of which were vaccinated. So with that being said, those are targets that we like to look at. In my office, we have been involved, like I said, with COVID from day one. We work with our local pharmacies, and to this point, we've established 15 or more vaccination clinics. Matter of fact, we have one going on next week with the Veterans Administration, or Veteran Services Officer here in Miller County. So we're hoping for a good turnout there, and we're kind of targeting those smaller groups of people. Just recently, yesterday, I sent out a public service or a media release and try to encourage our private businesses, our retail businesses, and even city and county government to revisit their COVID policy, because things have changed since early on in March and April when they developed these. And how are they going to deal with employees that either have been exposed or need to be quarantined, or can they work? And there are changes even within city government here. Some of our city agencies have people that are on COVID leave. So those are a couple of suggestions that I would have. Another one, you know, and I mentioned speaking about the county emergency coordinators. Early on, we got some information from the Arkansas Department of Health called patient data, and we could log on to a computer and retrieve information on positive patients of where they lived, not necessarily their names, but information on who was positive within our county. We use that for a lot of different reasons. The most important was to inform our first responders if they had to respond to a call in a COVID environment. But I'd also use that information to decide whether or not I needed to develop another vaccination clinic. And then we'd also use it for our county and city government leaders to inform them so they can make more informed decisions with the medical community on where we were to go from there. That information was suspended in June. And so with the resurgence of our COVID that we have, right now in our local hospitals, we're looking at an inpatient care that mirrors what we had in March of 2021.
Saying we need to reinvigorate some of that?
Yes.
Okay. You getting that, Doctor?
We need to provide that to the county emergency management. And I know there's some security issues with that, but if it were to be funneled through the Department of Health or a local county health agency, but that is an invaluable resource for us.
All right, so let me come back, though. This is really an important point. You're the emergency manager here in Miller County.
Yes.
And so if there is a need in Miller County, if we wanted to have a clinic somewhere, or if we needed an outreach and you needed some financial assistance, you can make the request, if it's COVID-related, to your emergency manager right here, and then he would channel it up and we can review it and see if we can help. Is that right?
Basically, yes, but we work so well with our local pharmacies. We provide them with a venue, they provide the staffing, and the staffing is the most important. They're the hardest to find.
Right.
As we'll probably see within the coming months, if we have a resurgent spike in COVID, our staffing levels are going to be a challenge, and wide across the state of Arkansas. But it doesn't necessarily take money. We can provide a venue. I'll find a venue. I'll find a drive-through if I have to. We've done it in a lot of various places. I have a tent if we need to use it. So we don't need money. We just need the people to come give the shots.
Dr. Romero.
So let me address your question about minority outreach. So we have an active outreach program through Dr. Michelle Smith. And I want to extend this as an open invitation to all of you. We will deliver vaccine to any event that you all set up, right? If you call me tomorrow or you email me tomorrow and you say, I'm going to have a vaccination event at X place, we will work to do that. We can directly reach out. You don't have to go through anybody, just call us also. We also have faith-based outreach, and we are actively reaching out to churches in our state and trying to make sure that you all have that information. So that is available, and we want it to be used. So please feel free either to reach through your emergency management or call us directly, because we have the ability to bring you that vaccine at short notice.
All right. Thank you, Dr. Romero. I try to keep these at about an hour, but I don't want to cut him, and we have a question or comment right here. Yes, sir.
Hello, Governor. My name is Ed Black. I'm a Miller County resident. Just a couple of comments. I got to leave here in just a minute, so I want to get them in. The gentleman talked about trust. I can see how people could be skeptical when this thing first started, because a year ago this was brand new to all of us. It was a moving target, and I felt like the people who were stating facts were stating the correct facts at the time they had the information. Things change, so the facts change. I wouldn't want to be stuck with one person thinking one thing all the time and not changing with what the results were from other tests. Talking about long-term effects, I've lost 2 friends. Now, Dane sure know what the short-term effects can be. And so I'm not worried as much about the long-term as I am right now. And I don't want to see any of my family gone, and I don't have to worry about them. So I got my shot.
Thank you, sir. I want to end with an ad. We might even darken this a little bit if we can do the lights, just so you'll see something that we have out there, a public service announcement. I really appreciate this young lady coming forward with her story.